Hi there, welcome to my channel. My name is Manny. This channel is dedicated to helping reverse diabetes, prevent it, and manage it better. So I've got loads of videos about how I've gone about reversing my type 2 diabetes. And today I'm going to share with you what happened when I was diagnosed and how I started treatment on insulin, then went on to something called metformin. Okay, but the real reversal to and the best way of managing diabetes is just through lifestyle. So let's share my screen now. So let's do that. So look, when I was diagnosed, through my physician, they did a HbA1c test. It's a blood test to see how much sugar you've had in your bloodstream for the last 3 months. Okay, and the number came out at 14.7. What does the number mean? If you have a look at this column here that I'm highlighting, okay, 14.7, if you have a look in there, is greater than 11.5 on this scale. So I was already way off the charts in terms of my diabetes. So that's why I was diagnosed as type 2, and I had to be put on insulin as soon as I could. Because what the ideal scenario is, you want to be around in the green area. I want to be about 6.5, they reckon. But today I am not on medication and I am not on insulin. I'm just managing it through my lifestyle, my type 2 diabetes. And the last HbA1c I did, which was last month. So for the last 3 months on there, I came out at 6.7, which is perfect. Yeah. So, okay. So today let's have a look at what happened when I was diagnosed and how I started the treatment. Okay, so I had to go to a clinic. The doctor sent me to a diabetic clinic, which is part of our local hospital here. And what they did first of all was they showed me how to measure my own blood glucose level using this meter and a lance where I would get a blood sample. There's a video on my channel on how you actually do a your own blood glucose level testing. Okay, so and they got me to be doing this 4 times in a day. So it's quite intrusive to one's life. Yeah, so I had to do it once I got out of bed in the morning before my breakfast. Then I did it before lunch, and then I did it before my dinner, and then I had to do it before I went to bed. Okay, and part of doing it at that frequency is to find out what the blood glucose level was at that particular time, so that I could inject myself with the right amount of insulin using this pen. So it's all about needles, and I don't like needles. I don't like needles. And here I am. I'm having to prick myself to get a blood glucose level 4 times a day, and then inject myself twice a day. Now, the amount of insulin I had to inject myself, insulin is done in units. So I had to do 12 in the morning and then the 12 at dinner time. Okay. Now that started to help me bring my blood glucose level, but there's a problem with insulin, injecting yourself with insulin. You are at risk of going through this thing called a hypo. When you are hypo, that means that the blood glucose level, it's too low. Well, hey, it's too high, but then inject yourself with insulin, and then there's a danger that it could be too low. So because I was on insulin, the first thing they had to do was I had to write to the DVL. See, that's the authority here in the UK for giving you a driving license, DVLA. And they took my license away from me and then issued me with a new license, which had to be renewed every 3 years. And then they gave me all these strict instructions about how I'm not allowed to drive, okay, unless I was higher than 5 on here. So where you got this level, that was when I had a hypo risk, but it was at nighttime. I couldn't have driven. I had to get in some carbs, eat some bread, have some wine gums, and drink some orange juice to get higher up. If not, if I stayed in this hypo level and I started going any further down, I could have fainted and lost consciousness. But if it was bedtime, I could have been crying in my sleep. Having nightmares, I could be confused, and blood vision, increase my heart rate, excessive sweating. But the danger is this fainting and losing consciousness, especially because I live on my own. So if I had lost consciousness, then that was me gone now. Okay, so I'm trying to use medication or insulin to bring my blood glucose level down, and there's another risk there. So I had to monitor this very closely. So anyway, so I started to change my lifestyle. Insulin was doing his work as well. And then after 2 weeks, the consultant at this clinic then put me on what is called metformin. Now, metformin is a standard tablet that's used to treat type 2 diabetes if it's not too high. So I went on this metformin. I'm thinking, at least I'm off this insulin. Now I'm on metformin. Well, metformin's got its own side effects. I could have stomach pain, vomiting, bloating. I was having stomach pains, sometimes diarrhea and constipation, and headaches. Okay, so, and also the thing about metformin as well is that you can't drink alcohol if you're on metformin. So say bye-bye to alcohol as well. So come off insulin, which I could have ended up fainting, or if I went on to tablets, I thought, oh, at least I'm on tablets, right? Went on to tablets, and then I had all the side effects, and I couldn't drink any alcohol. I'm thinking, I need to get off this. But if I wasn't treated, you know that I could have had stroke, blindness, heart disease, problems with my kidneys, and I could have been amputated. So I had to be treated. But the best treatment is, and the real safe one, the long-term treatment, was how I've looked at my lifestyle. And that's where that's why I'm where I am today. So when I talk about lifestyle, I've looked at the food I eat, right? And reduce the amount of sugar. Well, I don't take any sugar, and carbs. You have to watch as well. So I take a very minimal amount of carbs. So I'll be doing a few videos on what food I eat, but looking at the food. The other thing I've had to do was to look at my stress level. I'll be doing a video on the stress level as well. Yeah, reduce the stress, things that cause me stress, so that doesn't impact my blood glucose level. And then the last thing as well is exercise. So I'm not talking about spending days in the gym, but I just go for walks at least twice a day. So 10,000 steps I aim for. Okay. So again, I'll go through that in future videos. And everything is in my book on how I've reversed this type 2 diabetes, 365-day journey. I've put the, well, it's less than 365 days. I've put on the bottom of this video the link if you decide to treat yourself to the book. Is available on Amazon. Don't forget to like and subscribe what I'm doing. And I look forward to seeing you on the next video. So see you soon. Thank you. Bye. Bye. Bye.